Hey guys, Jeremy here. So in today's video, I wanted to talk about um, hip and back pain. So one of the things I see with patients a lot is they'll talk about how their hips go out, or somebody's told them, "Hey, your hips go out." So maybe they've had a little bit of low back pain, maybe some glute pain, maybe even some pain like in the anterior portion, the front part of your hip. Um, and a lot of times, now everybody's a little bit different, but one of the common things I see uh, that will usually get missed by the practitioner is the position of the pelvis. So this is a beat up spine and a beat up pelvis, right? So this is your low back, this is your sacrum and your pelvis, and this is if you were facing towards me. So what happens is when that pelvis gets tipped and rotated, usually from muscle imbalances, it'll get tipped and rotated like that. Now I'm exaggerating here, but usually it can go forward and rotate. Usually we see it go forward and rotate. What happens then, I'm going to turn it around, we're going to face you. When that pelvis tips and rotates, your hip socket, your acetabulum, it's going to be starting from a different position. So now if we say this is the normal position, but now you're walking around and you're tipped and you're rotated, that can put the starting point of your hip in a funky position, and you can get that discomfort in your hip, whether that's on the side, the front, the back, and the glute. That can put stress there, and it can also put stress in your lumbar spine because it's going to be tipped and rotated, and you just get a lot of torque in there. So this one is a little bit technical, but essentially it boils down to you can have a muscle imbalance that's pulling these muscles back and off that way. And what happens is if we don't address the cause of that problem, that muscle imbalance, you'll just continue to have those issues. So if somebody's treating the symptom and not getting down to the root cause of the problem, you might feel good for a little while, but it's not going to last. Maybe you feel good for the rest of the day, a couple hours, 10, 20 minutes, but it'll keep coming back until you correct that problem, that muscle imbalance. Okay, hopefully that one wasn't too long and too rambling, too boring for you. Okay, take care. Bye-bye.